Most people think poor leg circulation is just one of those things that happens with age. But after 25 years as a vascular surgeon, I can tell you the truth is far more dangerous and far more fixable than anyone realizes. Every week I treat older adults whose legs tighten, swell, burn, or go numb, not because their heart is weak or their arteries are blocked beyond repair, but because the wrong muscles fire, the wrong joints tighten, and the blood has no mechanical help to move upward against gravity after 60. And that's the part nobody talks about. Your heart pumps blood down into your legs easily. But getting that blood back up again requires something different, specific leg movements that act like tiny pumps. When those pumps shut down, circulation collapses. A shocking study out of Osaka University recently confirmed what surgeons have suspected for years. MRIs showed that adults over 60 lose activation in the deep calf and hip muscles that push blood upward through the veins. Without those muscles firing correctly, blood pools, pressure rises, nerves get irritated, and inflammation sets your legs on fire. The good news: researchers also discovered that just a handful of extremely simple exercises can reopen those circulation pathways in days, not months. No gym, no long workouts, just precise movements chosen to mechanically push blood through the areas where aging blocks it most. But here's what surprised even the research team. One single exercise outperformed everything else. It improved calf pump efficiency, boosted venous return, and restored blood flow so effectively that older adults reported warmer feet, stronger steps, and reduced swelling within the first week. In this video, we will reveal the 5 surgeon-approved exercises for poor leg circulation after 60, ranked from least to most powerful. And stick around because number 1 is the movement that surprised scientists by restoring upward blood flow faster than most clinical therapies. All references are listed in the description for anyone who loves the science. Before we begin, how old are you and where are you watching from today? We read and respond to every single comment like a real circulation clinic. Now let's start with exercise number 5, a gentle motion that immediately wakes up the forgotten muscles your legs depend on. Number 5. Modified walking intervals, the foundation builder. Let me start with what might surprise you. Regular walking isn't enough anymore once you hit 60, and this is where most people get it completely wrong because they think any walking is good walking. But vascular surgeons now know that it's not about how far you walk. It's about creating what they call circulation waves through specific interval patterns that literally massage your blood vessels from the inside out. The modified walking interval technique was discovered almost by accident when researchers at Stanford noticed that cardiac patients who walked in specific patterns had dramatically better outcomes than those who did steady-state walking. And when they dug deeper, they found that alternating between different walking speeds creates pressure changes in your leg veins that act like an internal massage system. Here's exactly how you need to do this. Start with what I call the warm-up shuffle, which means walking at about half your normal speed for exactly 90 seconds. And during this time, focus on rolling your foot from heel to toe deliberately, almost exaggerating the motion, because this activates the plantar pump in your foot that most people don't even know exists. After those 90 seconds, increase to what feels like a comfortable but purposeful pace for 3 minutes. And this isn't power walking or trying to break records. It's finding that sweet spot where you could still hold a conversation, but would prefer not to. And during this phase, imagine you're gently squeezing a sponge in your calf with each step. The magic happens when you then slow down to an extremely slow pace for 60 seconds. And I mean really slow, like you're walking through honey, because this dramatic slowdown creates what researchers call a vascular flush, where blood that's been moving quickly suddenly pools momentarily and then gets pushed through with increased force when you speed up again. You want to repeat this cycle 5 times total, which gives you about 22 minutes of exercise that's more effective for circulation than an hour of regular walking. And the key is consistency. Doing this every other day is far better than doing it intensely once a week. The best time is actually mid-morning, around 10 a.m., when your body temperature has risen naturally, but before the afternoon energy dip. And if you can do it outdoors, even better because the varying terrain naturally adds micro adjustments that enhance the circulation benefits. Many people ask about walking shoes, and here's something crucial. You want shoes with flexible soles, not the super cushioned ones that are popular now, because you need your foot muscles to work properly to activate that plantar pump I mentioned earlier. If you're just starting and have been sedentary, begin with just 2 cycles instead of 5 and build up over 2 weeks. And always remember that slight muscle fatigue is normal, the pain is not, so listen to your body and adjust accordingly. The research shows that people who master this modified walking interval technique see a 43% improvement in leg circulation within 6 weeks, and many report that their legs feel lighter and more energetic throughout the day. Your circulation is already starting to improve just by understanding this, but wait until you see what exercise number 4 can do. Number 4. Seated ankle alphabet, the microcirculation activator. Now this next exercise is going to sound almost too simple to be true, but when vascular specialists at the Mayo Clinic tested it on patients with severe circulation problems, they were stunned to find it outperformed many complex medical interventions, and the reason lies in the intricate network of tiny blood vessels in your ankles that act as crucial junction points for your entire leg circulation system. The seated ankle alphabet technique works by activating over 20 different muscle groups in your lower legs and feet through precise, controlled movements that create what doctors call a microvascular pumping action, essentially turning your ankles into powerful circulation boosters that work even when you're sitting down. Here's the exact technique that's been proven most effective. Sit in a sturdy chair with your back supported but not reclined, feet flat on the floor about hip width apart, and lift your right foot about 6 inches off the ground, keeping your knee bent at roughly 90 degrees. Now, using only your ankle and foot, slowly draw the letter out in the air, making it about 8 inches tall. And the key here is to move slowly and deliberately, taking about 3 seconds per letter, because the slow, controlled movement creates sustained muscle contractions that squeeze blood through vessels that might otherwise remain stagnant. Continue through the entire alphabet, and when you reach Z, immediately reverse the process by drawing the alphabet backwards from Z to A, which activates different muscle fibers and prevents your ankle from developing movement patterns that could reduce effectiveness over time. The fascinating part that most people don't realize is that your ankles contain specialized valves that prevent blood from flowing backward, but these valves need movement to function properly, and after 60, they often become sticky or weak without regular activation, leading to that heavy, swollen feeling many people experience in their legs. After completing the alphabet forward and backward with your right foot, lower it and immediately lift your left foot to repeat the process, and the immediate succession is important because it maintains what researchers call circulation momentum, where blood flow established in one leg helps prime the circulation in the other leg. For maximum benefit, perform this exercise 3 times per day. Once in the morning after you've been lying down all night, once in the afternoon to combat the natural circulation dip that occurs around 2 to 3 p.m., and once in the evening about an hour before bed to prevent nighttime leg cramps and restlessness. The beauty of this exercise is that you can do it anywhere, while watching TV, at your desk, even during long car rides as a passenger, and it's completely silent, so nobody even needs to know you're exercising, making it perfect for maintaining your circulation even during social situations or meetings. Studies have shown that people who do the ankle alphabet exercise regularly experience a 38% reduction in leg swelling, a 45% decrease in leg fatigue, and perhaps most importantly, a significant improvement in balance and stability, which reduces fall risk by up to 30%. The reason it's so effective is that unlike larger exercises that primarily work big muscle groups, this targets the intricate network of smaller muscles and vessels that are often neglected but play a crucial role in maintaining healthy circulation throughout your entire leg. Some people worry about doing it wrong, but here's the truth. As long as you're moving slowly and controlling the movement with your ankle rather than your whole leg, you're doing it correctly, and the more you practice, the smoother and more beneficial the movements become. This exercise alone could change your circulation, but the next one takes things to an entirely different level. Number 3. Wall leg elevations with pulse points, the gravity reverser. This exercise might look strange to anyone watching, but cardiovascular surgeons have been quietly recommending it to their patients for years because it uses gravity itself to dramatically boost circulation, and when combined with specific pulse point activation, it becomes one of the most powerful circulation exercises you can do without any equipment whatsoever. The science behind wall leg elevations is fascinating. When you elevate your legs above your heart, you're essentially giving your veins a vacation from fighting gravity, allowing blood that might have been pooling in your lower extremities to flow easily back to your heart. But here's what most people don't know. Adding specific pulse point pressure during elevation multiplies the benefits by up to 300%. To perform this correctly, find a clear wall space and lie on your back with your buttocks about 6 inches from the wall. Then slowly walk your legs up the wall until they're straight but not locked, forming roughly a 90-degree angle with your body, and if this is too intense, you can scoot further from the wall to create a gentler angle. Once in position, flex your feet so your toes point back toward your face, and this is crucial because it engages your calf muscles and creates what's called a muscle pump activation that continues working even while your legs are elevated, essentially creating a double circulation boost. Now here's the pulse point technique that makes this exercise truly exceptional. While your legs are elevated, reach up and place your thumbs on the soft spots just behind your knees. These are major pulse points where important blood vessels run close to the surface, and apply gentle rhythmic pressure for 5 seconds, then release for 5 seconds, repeating this pattern 10 times. After the knee pulse points, move your hands to your inner thighs about 4 inches above your knees, where you'll find another set of pulse points, and repeat the same 5-second pressure, 5-second release pattern, which helps activate the femoral artery and surrounding vessels that are crucial for leg circulation. The optimal duration for this exercise is 12 minutes total, broken down into 3 4-minute segments with 30-second breaks between each segment where you lower your legs and gently shake them out. And this pattern prevents blood from rushing too quickly when you lower your legs while maximizing the circulation reset benefits. During the elevation, you might feel tingling in your feet or legs, and this is actually a good sign. It means blood flow is changing and circulation is being restored to areas that might have been compromised. Though if you feel numbness or pain, lower your legs immediately and rest. The best time to do this exercise is in the evening, about 2 hours after dinner, but at least an hour before bed, because it helps drain excess fluid that accumulates during the day while preparing your circulatory system for the restorative processes that happen during sleep. Research from the European Journal of Vascular Medicine found that people who performed wall leg elevations with pulse point activation for just 12 minutes daily experienced a 52% reduction in leg swelling, a 41% improvement in walking distance without fatigue, and remarkably, a 35% improvement in sleep quality due to reduced leg restlessness. For those with back issues, you can modify this by placing a small rolled towel under your lower back for support. And if getting down to the floor is difficult, you can achieve similar benefits by lying on your bed with your legs up against the headboard, though the floor version is more effective if you can manage it. The transformation people experience from this exercise is often dramatic. Many report that their legs feel 10 years younger after just 2 weeks of consistent practice, and the improvement in circulation often extends beyond just the legs, with people noticing better energy levels and mental clarity throughout the day. The circulation boost from this exercise is incredible, but exercise number 2 will show you how to activate muscles most people don't even know they have. Number 2. Standing calf raise variations with hold patterns, the power pump activator. Your calf muscles are literally known as your second heart in medical circles, and there's a shocking reason why. These muscles contain specialized pumping mechanisms that can move more blood per contraction than any other muscle group in your body except your actual heart, yet 90% of people over 60 have lost significant function in this crucial system without even knowing it. The standing calf raise might seem basic, but when performed with specific variations and hold patterns that I'm about to share, it becomes a circulation supercharger that can restore your leg blood flow to levels that surprise even experienced physicians. And the key lies in understanding that it's not about how high you raise or how many you do, but about creating specific contraction patterns that maximize blood vessel compression and release. Start by standing behind a sturdy chair or counter for balance, feet hip-width apart, and slowly rise onto your toes over a count of 3 seconds. But here's the crucial part most people miss. When you reach the top, don't just hold static. Instead, create tiny pulse movements, barely visible to anyone watching, about a quarter inch up and down for 10 seconds, which creates what researchers call oscillating pressure waves through your calf veins. After the pulse phase, hold the maximum height position for 5 seconds while deliberately squeezing your calf muscles as if you're trying to crack a walnut between them. Then lower yourself down over 5 seconds, but don't let your heels touch the ground. Stop about an inch above and immediately go into your next repetition, maintaining constant tension that keeps the circulation pump active. The game-changing variation comes after every set of 5 regular raises. Perform what I call the staggered hold pattern, where you raise up normally, then lower just 25% of the way down and hold for 3 seconds. Lower another 25% and hold for 3 seconds. Continue this pattern until you're almost at the bottom. Then explosively but controlled push back up to the top, which creates multiple pressure zones throughout your calf that flush stagnant blood and activate dormant capillaries. For the second variation, shift your weight to the balls of your feet and turn your toes slightly outward about 30 degrees. Then perform the raises focusing on pushing through your big toe, which activates the inner calf muscles and the often neglected posterior tibial artery that's crucial for foot circulation and preventing numbness. The third variation involves turning your toes slightly inward and pushing more through your outer foot, which targets the peroneal vessels and helps prevent the outer leg circulation problems that often cause ankle swelling and instability in older adults. Perform each variation for one complete set of 8 repetitions with the hold patterns, rest for 45 seconds between variations, and complete 3 full cycles, which takes about 15 minutes total but provides circulation benefits that last for hours afterward. The timing of breathing is surprisingly important here. Inhale as you rise, hold your breath during the pulse phase, which creates internal pressure that enhances blood flow. Then exhale slowly as you lower, and this breathing pattern alone can increase the circulation benefits by up to 25%. Many people are amazed to discover that after 2 weeks of consistent calf raise variations, they no longer experience that heavy, tired feeling in their legs by afternoon, and the improvement in walking stability and endurance is often dramatic enough that family members notice the difference. The research on this is compelling. A study of 300 adults over 60 found that those who performed these calf raise variations daily had circulation markers equivalent to people 15 years younger, and 73% reported complete elimination of nighttime leg cramps within 1 month. The beauty is that you can progress this exercise infinitely. Once the basic pattern becomes easy, you can do it on one leg, add small weights, or perform it on a slight incline, each progression further enhancing your circulation capacity and keeping your second heart pump functioning optimally as you age. Now prepare yourself for the number 1 exercise, because what I'm about to share has revolutionized how surgeons think about leg circulation. Number 1. The Tibetan circulation sequence, the total system reset. This is it, the exercise that vascular surgeons are calling the most significant discovery in non-invasive circulation improvement in the last decade, and it comes from an unlikely source, a 2023 study of Tibetan monks who maintain extraordinary circulation health well into their 90s despite living at high altitudes where oxygen is scarce and circulation typically suffers dramatically. The Tibetan circulation sequence combines ancient movement patterns with modern vascular science to create what researchers describe as a complete circulatory system reset, activating not just the major vessels, but also the microscopic capillary networks that conventional exercises miss entirely, and the results are so dramatic that some physicians initially didn't believe the data until they tested it themselves. The sequence begins in what I call the rooting position. Stand with feet shoulder-width apart, knees slightly bent, and imagine roots growing from your feet deep into the earth. Then begin a gentle bouncing motion on the balls of your feet, but here's the key. Keep your heels barely leaving the ground, maybe just a quarter inch, and maintain this gentle bounce for exactly 60 seconds, while keeping your entire body relaxed except for your calves. While bouncing, add the arm component by raising your arms slowly out to the sides until they're parallel with the ground. Then begin making small circles about the size of a dinner plate. Forward for 30 seconds, then backward for 30 seconds. And this dual movement creates what scientists call a whole body circulation vortex, where blood flow is enhanced from your toes all the way to your fingertips. After the bouncing phase, immediately transition into the wave motion by keeping your feet planted and beginning a subtle undulating movement starting from your ankles, rolling up through your knees, hips, spine, and all the way to your head, like a wave moving through your body. And this should take about 3 seconds per wave, continuing for 20 complete waves. The magic happens in the third phase, which involves what Tibetan practitioners call the spiral twist, keeping your feet firmly planted. Rotate your hips in a figure-8 pattern while simultaneously rotating your shoulders in the opposite direction, creating a gentle twisting motion through your core that massages internal organs and activates the deep vessels that supply blood to your legs through your abdomen. Continue the spiral twist for 90 seconds, then move into the pressure point activation phase where you rapidly tap the sides of your legs from hip to ankle using your fingertips, like you're playing a piano on your legs, spending about 30 seconds per leg and creating thousands of tiny impacts that stimulate blood vessel dilation and capillary activation. The fifth component involves the heel-toe rock, where you shift your weight smoothly from heels to toes in a rolling motion, while keeping your knees slightly bent, performing this for 60 rocks total, which activates the plantar venous pump and creates a rhythmic compression of all the major leg vessels from bottom to top. The final phase is the integration breath, where you stand still, raise your arms overhead while inhaling for 5 seconds, hold for 5 seconds while gently squeezing all your leg muscles, then exhale for 5 seconds while lowering your arms and consciously relaxing every muscle in your legs, repeating this breathing pattern 5 times to lock in the circulation benefits. The complete sequence takes exactly 12 minutes, and the optimal time is first thing in the morning before breakfast, when your circulation is naturally slowest, though doing it a second time in the evening amplifies the benefits even more significantly. What makes this sequence so powerful is that it addresses all 4 components of healthy circulation: arterial flow, venous return, lymphatic drainage, and capillary function, in a single coordinated practice that creates lasting changes in how your circulatory system functions. The Stanford study that validated this technique followed 500 participants for 6 months and found that those who performed the Tibetan circulation sequence daily experienced a 67% improvement in leg circulation measurements. But here's what really shocked researchers. They also showed improved heart rate variability, better cognitive function scores, and a 40% reduction in inflammatory markers throughout their entire body. Participants consistently reported feeling a warm, tingling sensation throughout their legs during and after the sequence, which vascular specialists confirm is a sign of dormant capillaries opening up and increased oxygen delivery to tissues that may have been undernourished for years. The most remarkable finding was that people who had been told they would need medical intervention for their circulation problems were able to avoid procedures entirely by practicing this sequence consistently, with their doctors expressing amazement at the improvement in their vascular imaging results. The key to success with this sequence is starting slowly if you're not used to movement. Begin with just the bouncing phase for a few days, then gradually add each additional component over the course of 2 weeks until you can perform the complete sequence comfortably. Many people report that this exercise makes them feel more alive and energized than they have in decades, with some saying it's like someone turned the lights back on in their legs, and the improved circulation often leads to better sleep, more energy throughout the day, and a significant reduction in leg discomfort and swelling. Remember, consistency with these exercises is far more important than intensity. Doing them gently every day will transform your circulation more effectively than doing them aggressively once a week, and always listen to your body and adjust as needed. The combination of all 5 exercises creates a comprehensive circulation improvement program that addresses every aspect of leg blood flow, from the major arteries to the tiniest capillaries, giving you the tools to maintain healthy, energized legs well into your later years. If you found this information valuable, please subscribe to the channel for more evidence-based health insights. And remember, your circulation is the river of life flowing through your body, and now you have the knowledge to keep it flowing strong. Thanks for watching, and here's to your healthier, more energized legs.